I'm Abir Aldhalimi. I'm the Senior Mental Health Advisor at USAID, and I'm a clinical psychologist with a specialization in trauma and PTSD. I sit in the Inclusive Development Hub in the Development, Democracy, and Innovation Bureau at AID. What I'm going to be talking about today is trauma-informed programming. I want to start by talking through a bit around the interest in trauma-informed programming and how I came to be interested in trauma-informed programming. While working with individuals experiencing trauma clinically, it became clear that taking a trauma-informed approach was not only necessary for successful treatment, but also creating the systems of care that are responsible to the lived experiences of individuals will ensure that we do no harm. So I started thinking in systems. And then I started working for USAID. And while working for AID in the development context, I work with marginalized populations who have experienced violence, discrimination, stigma, a whole lot of human rights violations of all types, and mental health conditions that might be brought on by these experiences or have been worsened by these experiences. USAID and the Inclusive Development Hub ensures that we uphold the principle of do no harm in any of the programmings that we do, but especially in programs for marginalized groups. And an important step in upholding the principle of do no harm is taking a trauma-informed approach. So for this presentation, I want to provide a very brief overview of trauma and then introduce a trauma-informed approach in programming. I'm fully aware that we could have a full workshop on this topic, but I'm going to be brief. I'm also cognizant that others are going to be presenting on the topic of trauma more comprehensively throughout the day, so I'm going to provide a brief overview. So, second slide. Thank you. Trauma is a complex experience that impacts individuals, families, their communities, and the systems they interface with in a variety of ways. We can understand the definition of trauma from the literature in clinical psychology, and that's where the Substance Abuse and Mental Health Service Administration, SAMHSA for short, has presented in their trauma and trauma-informed practice guidelines. And we usually pull from other agencies at USG, and they've been taking the lead on trauma-informed care. So trauma is a result from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental health, physical, social, emotional, or spiritual well-being. I want to highlight a point that clinically, we've moved from the concept that an event has to be life-threatening for it to be considered traumatic. But that's the definition as it stands, and it should be updated. So essentially, trauma is a response to a distressing event. These distressing events are often termed as potentially traumatic events. The potential bit is quite important because there is a diversity in the way that an individual responds to a traumatic event. Often trauma is thought or linked to post-traumatic stress disorder, but it is quite diverse in that a person could experience different clusters of anxiety, different clusters of depression, post-trauma, and obviously these are going to be culturally bound and gender bound. So males may experience them differently than females. The manifestation of these symptoms may also be different, for instance, in Latin America region versus the Middle East versus in the Southern Africa region. So potentially traumatic events, these can include child neglect, sexual, emotional, and physical abuse, violence, sexual assault, human rights violations, mass casualties, and of course, poverty. These are quite spread. In fact, one of my favorite studies is administered over 24 countries across 6 continents, and they assessed the lifetime exposure to 29 potentially traumatic events in the general population. So they went out and they asked a whole bunch of people across 24 countries if they've experienced these 29 potentially traumatic events. And more than 70% of the participants reported experiencing a traumatic event, with more than 30% experiencing 4 or more of these traumatic events. even though the majority of individuals, especially in adulthood, are going to go on and not have a clinically relevant or debilitating trauma response. But a significant number of those individuals will in fact go on to develop a mental health condition like post-traumatic stress disorder. Next slide, please. Traumatic events can be personal, like interpersonal violence, and collective, like war. They could be current and historic, and it impacts multiple generations. And this is actually quite new in the last 10-ish years. I'm referring really to Rachel Yehuda's work on children and grandchildren of Holocaust survivors. She conducted this study in the New York region in the United States, and she found out that that children and grandchildren of Holocaust survivors were more prone to developing anxiety and mental health conditions. And through the passing down of specific stress-related genetic material through epigenetics, which is quite fascinating and provides us an additional layer of understanding of how the impact of trauma on individuals. While an event may have little impact on one person, it can have severe distress, and hence the diversity, as stated by the variables in the last slide. There's also a dose-response relationship associated with trauma. This means that the more potentially traumatic events one encounters, the more likely they'll go on and develop an adverse reaction, both physically or psychologically. Next slide, please. So with respect to interventions, we can address specific symptoms through trauma-specific services. These are your traditional therapy, specific programs, therapeutic services that are basically aimed at treating the symptoms or conditions associated with the traumatic event. However, due to the fact that negative impact of trauma on the physical and mental health can potentially be lifelong or long-lasting, it became imperative not only to address the individual symptoms one-on-one or through group therapy, but also on a system level. And so individuals who have experienced trauma can then benefit from these emerging best practices in trauma-informed care. And trauma-informed care is an approach that aims to ensure that the environment and services are welcoming and engaging to the individuals participating in these programs. And staff. It's important to also recognize that staff care is an important aspect of trauma-informed care as well. These practices involve organizational changes that have the potential to improve not only the individual's engagement, but actually boost the effectiveness of whatever intervention you're using and aid with provider and staff wellness. Harris and Fallett introduced the idea of trauma-informed care in, I think, 2001. And in the last 20 years, there have been concerted efforts to further define and understand trauma and trauma-informed care approaches and incorporate them not only in the setting at the clinic, but also through policies and practice and workforce development. Next slide, please. While there has been great progress in this area, there really isn't one definition for trauma-informed care. However, there are common elements and assumptions in this work. Essentially, trauma-informed care incorporates the realization of the impact of trauma and understanding the impact of recovery. There's recognition of signs and symptoms of the trauma, as well as integration of knowledge of trauma into policies, procedures, and practice. This knowledge focuses on creating a sense of safety and better understanding the power dynamics in that setting. Power dynamics are quite important just because when an individual experiences a traumatic event, often part of that experience is not having power or feeling disempowered. And so creating a system that understands that and balances the power dynamic is quite important. And of course, a do no harm approach that actively avoids re-traumatization. The way an organization is set up may inadvertently remind the patient of the trauma and lead to feeling distressed. Next slide, please. So as I said, trauma impacts all aspects of one life. There has been a growing interest to also pursue trauma-informed approaches outside of the health systems. I've been really interested in understanding how trauma-informed approaches fit into the development context when I moved over to working in development. And the last several years, I have seen quite a few activities that were interested in incorporating a trauma-informed approach, especially for programs that serve marginalized groups. As I said, marginalized groups are more likely to experience trauma, and the impact of trauma not only impacts an individual's well-being, but it actually can go on and impact the programming initiative. So how does one's trauma impact the program? Individuals impacted by trauma may be less likely to engage in programming to diminish motivation and all the other symptoms and the symptom manifestation that impacts interaction with other individuals or interaction with communities. We can actually then see that into programming as well. Individuals may be less likely to engage due to fear that the program may trigger their trauma. I've actually seen this occur in programs like gender-based violence programs, for instance. If there isn't a thoughtful way of engaging participants or engaging beneficiaries, or maybe we're collecting data on past experiences, that could be quite overwhelming and distressing, and individuals may drop out of the program and are less likely to engage. Also, without proper planning and consideration for trauma, our programming may inadvertently re-traumatize individuals or make them feel less safe when participating. I'll give you an example. This is actually a personal example of mine. When I first started my work at AID, I flew out to Morocco to assess, to do stakeholder consultations and assess programming priorities for this group, and bring it back to our mission in our country office to help with program design. And I went about my questions the same way, the same standard way, I've been taught, and it was, nothing spectacular happened out of it. The questions were quite benign. But the dynamic in the room shifted for me when I began to interview West African refugees in Morocco. And the questions that I was asking about their lived experience, about how they engaged in programming, about social services that they were receiving, that became quite overwhelming to the stakeholders that I was engaging, to a point where I had to stop the interview. And it was that aha moment for me. It was that light bulb moment for me to recognize that even though things have occurred in the same way at the agency, we've always asked the same questions. It really hasn't impacted or shown much change or a tendency for change. It made me realize that even the benign questions can be experienced quite overwhelmingly depending on the population I'm working with, and change does need to happen. And it's not very difficult to think through and be thoughtful about how to ask questions, about the consideration of the individual's lived experience while in the room, about setting up the room in a certain way to make them feel comfortable, about giving them the power of consent and letting them stop the interview. I'm the donor. I'm going to have more power in that room and skew that power dynamic. And recognizing that I state outrightly that they have the power to leave, they have the power to stop, and ask the questions in a way that suggests that they're the ones that are steering the wheel. Very simple tweaks in the way that I approach things could be quite powerful, not only to give agency and respect the person that I'm interviewing, but it also means that I can do this job and do this job with a good conscience and make sure that I'm respecting the individual in front of me and respecting that they might be overwhelmed by very simple questions. And from this work, we've been thinking through trauma-informed approaches in our programming and aid. So taking these elements together and taking some of the examples I provided, it makes sense that trauma will eventually hinder the effective development by hindering the ability to achieve our organization's objective. And any organization's objective, even outside of development. If you're not able to do your day-to-day tasks, day-to-day work, you're probably not going to achieve the overall organizational priorities. Ultimately, what we want to do is utilize a trauma-informed approach that will create a safe, inclusive, and an effective program. Next slide, please. So what do these programs look like? I think there is a theme in what I've just been presenting on. There really isn't one way of doing this. There isn't a lot of, this isn't a cookie cutter approach. And the data shows that there are certain elements that, that we could use to help us, that help tie these programs together. And there's some commonalities here. Trauma-informed programming is going to look different depending on the setting and is going to be unique based on the individuals being served and the type of organization. For instance, doing a program for gender-based violence is going to look different than a program for gender and sexual minorities. It's also going to look different for religious minorities. These programs are going to have to be tailored, hence the workshop aspect. So an organization that aims to prioritize trauma-informed approach is going to have to commit to certain elements. And these include creating principles that are culturally adaptive and responsive, and of course, respectful of individuals' lived experience. Stakeholder engagements ensure that we're involving the beneficiary or the participants and receiving their feedback. I actually would like to challenge this. I'd like to move beyond just stakeholder engagement. What we ultimately want to do is partnership. We want to make sure we partner with participants or beneficiaries to ensure that they are guiding the work, they're guiding the program design. They're best positioned to ultimately tell us what they want and what would serve them well. This is a similar point to what Dr. Patel stated in the previous presentation. They need to be involved, and so partnership is the most powerful way to do that. Choice and empowerment of individuals are essential to facilitating healing and avoiding re-traumatization. And this is true for both the service recipient, the beneficiary, or the staff. Workforce development is important, and training staff on the elements of trauma and trauma-informed best practices is essential. Part of this training should include do no harm approaches, of course, and respect for individual agency, very much like the example that I gave, the understanding the power dynamics and looking at beneficiaries, looking at participants as individuals who know what they want and not looking at them as though they are a victim, and allowing for that agency to occur is really important, not only in the one-on-one relationship, but in creating successful programming. An organization's policy and practice should reflect the commitment to physical and emotional safety for, again, the staff as well as the participants. Focusing on strength and resilience of participants will help them heal. Not avoiding looking at them as victims, and really focusing on the strengths and looking at the resilience is going to be an effective way to move your programming forward. And of course, making sure you're respecting your beneficiaries. So ultimately, what we're creating is a complete cultural shift. This is not going to be easy. This is absolutely not going to be easy, but it is a commitment that could pay greatly for not only your program and the effectiveness of your program, but ensuring that we're engaging in a way that is inclusive and is respectful. Essentially, what we're doing is creating an overarching framework that guides an organization or a program and ensures that healing and empowerment of participants are at the forefront of what we do. So that's what I'm going to stop here.